This video will demonstrate a lymphatic massage sequence for the head and neck region. Take your time with this sequence. It can be done in sitting, standing, and any time of the day that you choose. Typically, lymphatic massage can commence 2 to 4 weeks after your surgery, once your scar has healed or your skin has healed after radiation therapy. Check this over with your doctor if you have any questions. Step 1, take some deep breaths. I'll demonstrate how. Take a breath in, move your arms out, stretch, hold, breathe out. Try and keep your shoulders relaxed as you do this. Breathe in, 1, 2, 3, 4, 5, stretch, out, 2, 3, 4, 5. Do that around 10 times. Step 2, do some exercises. We're going to demonstrate some for the shoulders, the neck, and the face and the mouth. Shoulder exercises. Do some shoulder rolls, nice and slowly, in a backward direction. You do about 10, then come forwards, nice and slowly. Try to be relaxed. Take your time, keep breathing. Do some shoulder shrugs, just like this. Lift up, drop down. You can retract your shoulders like this, like you're trying to squeeze a ball between your shoulder blades. Again, do this slowly. And if any of these are hurting your shoulders, either slow down, try again, or just don't do that particular exercise. Good. Next is your neck. We're going to do some rotations from one side and to the other side. Do this 10 times. Do some neck flexions. And backwards. Do it 10 times in each direction. Do some sideways stretching. Times each side. That's your neck stretches done. Next is your face stretches and tongue. First one is this one. Tip your head gently backwards. Open your mouth. Close your mouth. Come back down. I'll demonstrate again without speaking. You'll feel a real stretch right down here. The next one is opening your mouth and moving your jaw from side to side. Do it slowly, do it carefully. Do it as much as you can from each side. Take your time. Last one is opening your mouth and stretching your tongue like this. I know it looks funny, but it will really help. Okay, very good. That's the stretches done. Next, step 3, empty the lymph nodes. We have many lymph nodes in the head and neck. They are in these regions. Here, in this gully area above your collarbone. It's called your supraclavicular fossa. Next, there are some here at your neck area. then under your chin, in front of your ears, behind your ears, and at your cheeks. I'll demonstrate how to empty each area. Take the pads of your fingers and place it into this gully region above your collarbone. Gently press down and do circular movements. Do 10 or more on each side. Next, with the flats of your hands, place it on your neck. Be gentle on your surgery side. Gently do 10 circles. One side and the other side, 10 each. Then with the flaps of your fingers, come under your chin, come to the center of your chin. We're going to do one side first. Just near the midline, do 10 little circles, and then move to the middle and do 10 circles, and then to the outer ridge of your jaw, 10 circles. Do both sides. Next, with the pads of your fingers, do in front of your ears 10 times. You can do both at the same time. And then behind your ears 10 times. And lastly, do your cheeks. There's just 10 circles either side. Good, you've emptied your lymph nodes. The next step is to sweep fluid into the lymph nodes. If you're working on your surgery side, be confident that your skin has healed and this will not hurt it, but go gently. Place the flat of your hand onto your skin and sweep down towards that gully area above your collarbone. Stay in one plane of direction for at least 10 sweeps. Then move to the middle of your neck and do the same. At least 10 sweeps, one side, one direction. Then go to the outside of your neck and sweep down towards the gully above your collarbone. You can do both sides of your neck, but spend more time on your affected side or where the swelling is most prominent. Lastly, if you have a scar or a thickened area from radiation, you may need to drag the skin around your scar and then down towards this gully area. Sometimes the fluid is finding another pathway around the scar and down. You will have to experiment and see which works best for you. I'm imagining I have a big scar here and I'm going above it, around it, and down towards the gully area. Lastly, finish with some deep breathing, just like we did in the beginning. And that will give you a really great end to your lymphatic massage sequence. Well done.